Have you noticed any unusual behavior in your cat recently? This isn't a casual question, but a crucial one. Cats, known for their independence and sometimes aloof nature, are masters at hiding their discomfort or symptoms of illness. This survival instinct, while helpful in the wild, can make it challenging for owners to spot signs of health issues in their feline friends. As cat owners, we must be vigilant, learning to read the subtle signs our pets may be giving us. It's not just about understanding their unique personalities or quirks, but also about recognizing when something is off, when a behavior isn't just unusual, but potentially a sign of an underlying health issue. This kind of observation requires patience, understanding, and a deep bond with our furry friends. From changes in eating or grooming habits to shifts in sleep patterns or social behavior, even the slightest variation could be a signal. It's important to remember that noticeable changes in a cat's behavior are often not just whims or phases, but could be their way of communicating that something is wrong. Cats can suffer from a variety of health issues, ranging from respiratory difficulties and loss of appetite to more serious conditions like seizures or sudden weight loss. Each of these symptoms could be an indication of a different underlying condition, and understanding what they might mean is critical to ensuring your cat's well-being. It's also important to remember that not all health issues manifest in the same way in every cat. Just as humans have individual responses to illness, so do our feline counterparts. This makes it all the more important to know your cat well, to be able to recognize when something isn't quite right. The bottom line is, when it comes to our pet's health, we can't afford to take any chances. Unusual behavior should never be ignored. Instead, it should prompt a visit to the vet, where professional advice and intervention can make all the difference in your cat's health. A deeper understanding of your cat's behavior could be the key to their health and happiness. So let's dive into some of the most common unusual behaviors in cats and what they could potentially mean for your pet's health. Does your cat seem to be gasping for air or breathing heavily? There might be more to it than meets the eye. Breathing difficulties in cats can be a sign of serious health issues. They might not be getting enough oxygen, which can lead to distress and discomfort. The causes can vary from common respiratory conditions such as asthma and pneumonia to more severe ones like heart diseases. Asthma in cats can be triggered by allergens in the environment, leading to inflamed airways and difficulty breathing. Pneumonia, on the other hand, is an infection in the lungs which can cause rapid breathing and coughing. Heart diseases in cats can also cause breathing difficulties. Conditions like heart failure can lead to fluid accumulation in the lungs, making it hard for your cat to breathe. Understanding the potential causes is the first step. If your cat is struggling to breathe, it's critical to seek veterinary attention immediately. Has your cat lost its appetite? It's a question that might raise a red flag for many feline guardians. Cats, like humans, may go through periods where they're not as hungry as usual. However, if your cat's loss of appetite persists, it's time to dig deeper. A variety of underlying health issues can cause a cat to stop eating. Kidney failure, for instance, is a common condition in older cats that can lead to decreased appetite. Liver diseases, such as hepatitis or cirrhosis, can also affect a cat's desire to eat. Even more ominously, a loss of appetite can be an early symptom of certain types of cancer. Remember, cats are experts at hiding their discomfort, so a change in eating habits might be one of the few visible signs that something is wrong. If your cat's loss of appetite continues for more than a day or two, it's time to call your vet. A prolonged loss of appetite requires immediate veterinary attention. Is your cat vomiting more than usual? If you're nodding along, then it's crucial to understand the potential causes. Persistent vomiting in cats can often indicate serious health conditions. For instance, your feline friend might be dealing with an intestinal obstruction. This happens when something blocks the flow of material through their digestive tract, leading to distress and, you guessed it, vomiting. Another possibility is pancreatitis, an inflammation of the pancreas that can cause nausea and vomiting. Pancreatitis is often associated with other diseases in cats, such as liver disease or inflammatory bowel disease, further complicating matters. Lastly, your cat might be dealing with poisoning, which can occur if they've ingested something toxic. This could be a household substance, a poisonous plant, or even certain human foods. So, if your cat is vomiting persistently, don't brush it off as a minor issue. Persistent vomiting is a serious symptom that requires immediate veterinary attention. Does your cat have ongoing diarrhea? This could be more than just a minor upset stomach, as persistent diarrhea can be a symptom of several serious health conditions in cats. For instance, viral enteritis, a type of inflammation of the intestines caused by a virus, can lead to ongoing diarrhea. Parasitic infections, such as those caused by worms or protozoa, can also result in diarrhea. These parasites can enter your cat's system in various ways, like through contaminated food or water or from fleas. Inflammatory bowel disease is another potential cause. This is a condition where the cat's body's own immune system attacks the cells of the gastrointestinal tract, leading to symptoms like diarrhea. Remember, these are just a few examples of what could be causing ongoing diarrhea in your cat. If your feline friend is experiencing persistent diarrhea, it's not something to be ignored. Don't ignore persistent diarrhea, it's time to call the vet. Is your cat struggling to urinate? This could be a sign of a serious health concern. Urination difficulties in cats can stem from a variety of causes. Among the most common are urinary stones, urinary tract infections, and kidney failure. Urinary stones, also known as uroliths, are hard deposits that form in the urinary tract. These can cause discomfort and even blockage, making it difficult for your cat to urinate. Urinary tract infections, or UTIs, are another common cause. These infections can cause inflammation and discomfort, making urination painful and, in some cases, difficult. Kidney failure, while less common, is a serious condition that can affect a cat's ability to urinate. This is because the kidneys play a vital role in producing urine and removing waste from the body. Regardless of the cause, urination difficulties are a serious health concern and require immediate veterinary attention. Early detection and treatment can significantly improve your cat's prognosis, so don't delay if you notice any changes in your cat's urination habits. Has your cat been having trouble walking? This seemingly simple issue may have complex underlying causes that demand your attention. A cat's walking difficulty can stem from a variety of factors, including injuries, thrombosis, or neurological disorders. Firstly, injuries can be as minor as a sprained limb or as severe as a broken bone. Even a small injury can significantly impact a cat's mobility. Thrombosis, or blood clots, is another serious condition that can cause sudden limping or paralysis in cats. It's often associated with heart disease and requires immediate veterinary attention. Neurological disorders, such as degenerative myelopathy or cerebellar hypoplasia, can also lead to walking difficulties. These conditions affect a cat's coordination and balance, making it hard for them to move around normally. Remember, a cat's difficulty in walking is not a mere inconvenience. It's a sign that something is wrong. Walking difficulties can signal serious health issues and should not be ignored. Don't hesitate to seek professional help if your cat displays such symptoms. Has your cat been experiencing seizures? If so, it's crucial to understand that this is a serious medical condition, and immediate veterinary attention is required. Seizures in cats can be caused by various factors. Among the most common causes are epilepsy, brain tumors, and hypoglycemia. Epilepsy is a neurological disorder that can cause repeated seizures. Brain tumors, though less common, can also lead to seizures due to the pressure they place on the brain. Hypoglycemia, or low blood sugar, is another cause. It can result in seizures if a cat's blood sugar drops too low. It's essential to note that seizures are not a condition in themselves, but a symptom of an underlying issue. They indicate that something is wrong within the cat's neurological system. If your cat has a seizure, it's crucial to remain calm and contact your vet immediately. Seizures are a serious health concern and require immediate veterinary attention. Have you noticed any abnormalities in your cat's eyes? This is a question that should not be taken lightly. Our feline friends' eyes can reveal a lot about their overall health. One common issue is conjunctivitis, an inflammation of the eye's outermost layer. It can make your cat's eyes appear red and swollen, often accompanied by discharge. Next up is corneal ulcers. These are painful sores on the outer layer of the eye that can cause your cat to squint or rub their eye. If left untreated, it can lead to serious vision problems. Lastly, glaucoma, a condition where increased pressure in the eye leads to gradual loss of sight. This can cause a visible enlargement of the eye and may lead to blindness if not addressed promptly. Eye abnormalities can indicate serious health issues and should not be ignored. Always consult with a veterinarian if you notice anything unusual about your cat's eyes. It's better to be safe than sorry. Has your cat been experiencing skin abnormalities? This could be a sign that your pet is grappling with issues more severe than an itch. Skin abnormalities in cats can take many forms, including hair loss, itching, and rash. These symptoms can be caused by a variety of health problems, some more serious than others. One common cause is allergic dermatitis, a reaction to something the cat has come into contact with. This could be anything from certain types of food to plants, or even to fleas. Fungal infections are another potential cause, with ringworm being one of the most common culprits. This is a highly contagious skin condition that can spread quickly between animals and even humans. External parasites, such as fleas or mites, can also cause skin abnormalities in cats. These tiny creatures can cause a range of issues from mild irritation to severe skin infections. Skin abnormalities can indicate serious health issues and should not be ignored. So, if your cat is showing any signs of skin abnormalities, it's important to consult a veterinarian immediately. Has your cat been losing weight rapidly? This can be a red flag for several health conditions. Let's dive into some of the potential causes. Hyperthyroidism is one possibility. This condition occurs when the thyroid gland produces an excess of thyroid hormone, causing a spike in metabolism and consequent weight loss. Symptoms can include increased appetite and thirst, frequent urination, and restlessness. Another potential cause is diabetes, a disease that affects the body's ability to use sugar for energy. In cats, diabetes often leads to weight loss, despite an increased appetite. Lastly, cancer can also account for rapid weight loss in cats. While not all types of cancer cause weight loss, many do, and it's often one of the first noticeable signs of the disease. Remember, these are just a few examples. If you notice your furry friend shedding pounds at an alarming rate, it's crucial to seek veterinary help. Rapid weight loss is a serious health concern and requires immediate veterinary attention. Let's recap the important points we've covered. Cats are creatures of habit, and any unusual behavior can be a sign of a potential health issue. Breathing difficulties, for instance, could indicate serious conditions like pneumonia, asthma, or heart disease. A loss of appetite that persists could signal kidney failure, liver disease, or cancer. Similarly, persistent vomiting may point towards intestinal obstruction, pancreatitis, or poisoning. Continued diarrhea might be a symptom of viral gastroenteritis, parasitic infection, or inflammatory bowel disease. Difficulty in urination or the presence of blood in the urine could be due to urinary stones, urinary tract infections, or kidney failure. If your cat has difficulty walking or shows signs of paralysis, it might be suffering from trauma, thrombosis, or neurological disorders. Seizures, on the other hand, could be a sign of epilepsy, brain tumors, or hypoglycemia. Eye abnormalities such as discharge or cloudiness can be indicative of conditions like conjunctivitis, corneal ulcers, or glaucoma. Skin abnormalities such as hair loss, itching, or rashes could be due to allergic dermatitis, fungal infections, or external parasites. Lastly, rapid weight loss can be a symptom of hyperthyroidism, diabetes, or cancer. These symptoms could indicate serious diseases. Early detection and treatment can significantly affect your cat's prognosis. Therefore, if you notice any abnormal symptoms in your cat, it's essential to seek veterinary attention promptly. Cats often hide their discomfort, making it crucial for us to stay vigilant and attentive to any subtle changes in their behavior or physical condition. Remember, your cat's health is in your hands. Stay observant, and don't hesitate to seek professional help when needed.